Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of infants, continuing with the letter G and H. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I will be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and metabolism. After that, I'll address the issues of homeopathic remedies on infections, infestations in the immune system, issues surrounding fertility and pregnancy, childbirth, postnatal problems, special problems of infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories, called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Nature-Mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns of infants, continuing with the letter G and H. Special problems in infants. There can be little doubt that breastfeeding gives a baby the best possible start in life. However, milk is not let down immediately after a baby is born. For 3 days or so after birth, the breasts secrete a clear yellowish fluid called colostrum, which gives the baby valuable antibodies and hormones. The baby's sucking causes extra large amounts of a hormone called oxytocin to be released from the pituitary, which stimulates milk production and also helps the walls of the uterus to contract. The balance of minerals, vitamins, and proteins in cow's milk is not ideal for babies. Cow's milk contains many times more sodium, potassium, magnesium, calcium, and phosphorus than the baby needs. 3 times as much protein, which overtaxes acid secretions in the baby's stomach, resulting in indigestion and a proliferation of harmful bacteria, and only 1/3 of the vitamin C and 1/10 of the vitamin D that the baby needs. At birth, the baby's head is very large compared with the rest of the body. Head circumference is measured 3 to 4 days after birth and serves as a baseline for growth and for detecting any abnormalities. In tests, babies have shown themselves to be far more sensitive to the human voice than to pure tones and household noises. In other words, they possess an innate ability to distinguish speech sounds from other sounds, an ability fundamental to language acquisition. The first recognizable syllables that the baby utters, which are usually produced towards the end of the first year, are preceded by burbling and babbling as the pitches and rhythms of speech are tried out. Other tests have shown that even very young babies have a good memory for smells, and they recognize their mother by her smell. Physical development is most obvious in babies between 16 and 28 weeks, when the neck and trunk muscles develop, allowing the baby to sit up and look around and take experimental swipes at nearby objects. By 40 weeks, most babies are experienced crawlers, eager for horizons beyond the crib, and shortly afterward there are wobbly attempts to stand, though unsupported standing is not usually achieved until about a year old. The things to watch out for, particularly in infants, are fever and dehydration. Temperature quickly rises in response to infection, hot weather, too many blankets, and so on, and measures to reduce it should be taken very swiftly. To take a baby's temperature, put the bulk of the thermometer under the armpit for 3 minutes. Persistent diarrhea or vomiting can easily and quickly cause dehydration. Usually the cause of diarrhea is premature introduction of solids or too much sugar in the baby's feedings. Daily full baths are not essential for a baby. The essential areas to clean thoroughly are eyes, face, hands, and bottom. Granules are the most convenient form of giving homeopathic remedies to babies. They quickly dissolve on the tongue and cannot be spat out as easily as pilules. Alternatively, crush a pilule between 2 clean spoons, if you have no other form of the homeopathic remedy, and then dissolve it in a little warm water, and drop it on the baby's tongue with a dropper. Gastroenteritis. This is potentially very serious in very young babies, since the inflammation of the stomach and small intestine cause diarrhea and vomiting, and therefore dehydration. With this ailment, the stools are green and watery, and the baby develops a slight fever and tends to feed poorly and becomes miserable and irritable. The signs of dehydration are a dry mouth, sunken eyes, and fontanella, which is the spot on the top of the head where the cranial bones meet, the soft spot, and irritability. This condition is less common among breastfed babies, who are to some extent protected against bacteria and virus by antibodies in the mother's milk. Bottle-fed babies not only miss out on this protection, but also are exposed to germs harbored by bottles, nipples, and other feeding utensils. If the homeopathic remedies that follow do not produce some improvement within 12 hours, or if signs of dehydration develop, call your doctor. Specific remedies to be given every 1 to 2 hours, depending on the severity, for up to 10 doses. Milk makes symptoms worse. Stools green and watery. Baby limp and passive. Upper lip looks pale. Use Aethusa 6C. That is Aethusa 6C. Baby cold, weak, restless, and obviously miserable. Use Arsenicum 6C. Symptoms come on in cold, wet weather, or after catching a chill. Stools greenish, yellowish, or slimy. Use Dulcamara 6C. Colicky stomach pains, with legs drawn up. Gentle pressure seems to relieve pain. Use Colocynth 6C. Copious vomiting and diarrhea. Use Nux 6C. Baby chilly, apathetic, and makes a fuss if touched. Stools yellow and frothy. A lot of wind. Use China 6C. Baby very thirsty for cold water, which is vomited up as soon as it becomes warm in the stomach. Use Phosphorus 6C. Diarrhea with undigested food and stools. Baby seems better after passing stools, but shows no obvious pain upon doing so. Use Phosphoric Acid 6C. Self-help. If you are bottle feeding, make sure all utensils are sterilized each time you use them, and avoid touching the nipples once they have been sterilized, and never put them in your mouth. Stop feeding for 24 hours and give water with a little glucose and salt in it. 1 teaspoon glucose and 1/2 teaspoon of salt to 1 pint of boiled then cooled water instead. On the second day, give quarter strength feedings, the next day full strength, and the next day 3/4 strength, and on the 5th day, go back to normal strength feedings, but feed a little and often rather than a lot all at once. If you're breastfeeding, give extra spoonfuls of boiled, cooled water between feedings. These measures should produce some improvement within 24 hours, but if they don't, call your doctor. Head banging. Head banging usually means that the baby needs more love and attention. Banging the head on the sides of the crib is an expression of anger and hurt feelings. If the parents open up more, the baby will probably redirect the anger against them, at least for a while. Just occasionally, head banging may be due to an earache. In all cases, the sides of the crib should be padded to prevent injury. Specific remedies to be given last thing at night for up to 5 nights. First choice, use Millefolium 630C. Where head banging is part of the general withdrawal from people and becomes an obsession, use Silicea 30C. Baby very angry, impossible to please, soothed by being carried around but enraged by being put back in the crib, use Chamomilla 30C. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.